When you think you're done with COVID, but the virus isn't done with you, bodies under attack is no overstatement for many COVID patients desperate for help and the healthcare providers struggling to help. For the past 2 years, the I-Team has been looking into long COVID, a medical phenomenon that is as real and extensive as it is uncertain and unpredictable, especially in already vulnerable communities.
It was when the stuttering happened that I was like, something really is wrong here. And when I would have a brain freeze, where all of a sudden I couldn't think of anything.
Marta Serta caught COVID in October of 2020. She avoided the hospital, but her parents didn't. The disease took her mother's life. Months later, Serta realized her own body was still under attack.
Anxiety, brain freeze, stuttering, lower back pain, loss of smell, loss of taste, memory loss, fatigue, and more.
Estimates suggest that more than a third of COVID survivors will develop symptoms of long COVID. It can affect multiple systems and organs, including the brain and heart. Clues about the damage and causes are emerging, but researchers are far from cracking the code of a condition that varies in type, intensity, and duration.
Those of us with long hauler symptoms, we are silently suffering.
Adding to the complexity, long COVID does not yet have a universal definition. What most doctors do agree on is that a new wave of the mysterious illnesses is likely, and the U.S. needs to be prepared.
Looking at scans and research presentations from around the world, it's clear that COVID does some very serious damage to the body. So we don't know yet how much of that we can heal, but it's clear that there are some techniques and some medications that can help to manage people's symptoms.
Scientists on the ground floor of long COVID tell the I-Team the financial commitment required to unravel this health crisis must go further.
If we get some clues from patients themselves about things that are helping, we need to deploy that knowledge as a study to really test it out. And we need researchers who have funding and are doing that in ethical and appropriate ways, because when we don't fill that gap, that's when you can have predatory groups or organizations that are offering cures to long haulers that aren't cures.
The National Institutes of Health received more than $1 billion from Congress to help solve the mystery.
How can we treat it, and most importantly, how we can prevent it going forward?
As part of the NIH's Recover initiative, the University of Illinois Chicago is expected to receive $22 million to lead an Illinois-based team of researchers.
So his life is normal.
UIC's Dr. Heather Prendergast, one of the co-investigators, has spent much of her career focusing on health disparities. The Illinois project will analyze causes, treatment strategies, and prevention. A major focus, understanding how long COVID is impacting vulnerable communities, those historically underrepresented in research but greatly impacted by the coronavirus.
We're not looking at it as a study. It's a partnership to try to understand what is long COVID.
UIC now lining up relationships with community-based organizations.
This long COVID thing is real.
Pastor Chris Harris of Bright Star Church in Chicago's Bronzeville neighborhood has signed on. He says lives are at stake, and his faith community is not only interested in getting help, but providing answers.
The university said, this is what we want to do. We want to let the community lead the process, educate the people, and they said we're coming to the table not only as educators, but we want to be educated. That was different, and that's why I jumped in.
Marta Serta, an advocate for the Latino community and now a research volunteer, says more people in marginalized communities may be suffering from long COVID due to fewer resources or misdiagnosis.
Some days I just want to scream because I don't know how to get help. So the fact that there are physicians doing studies and they're trying to figure out what to do gives me hope.
NIH launched the Recover initiative more than a year ago. With bodies under attack from long COVID, some critics are questioning whether the program is moving at a fast enough pace. The 4-year study aiming to enroll 40,000 adults and children across the country. In Illinois, the current goal is to sign up 1,000 participants starting in Chicago.